See, there are different types of inhaler. One is a pressurized meter dose inhaler, then MDI with spacer. Then comes the breath actuator meter dose inhaler. Then comes the dry powder inhaler, nebulizer, soft mist inhaler. As the name suggests, the pressurized meter dose inhaler, it delivers the metered volume of the drug in each actuation. See, this is a pressurized meter dose inhaler. It has a canister which is filled with the propellant and the active component, that is the drug. Basically, there are two types of propellant. One is the chlorofluorocarbons, other one is the hydrofluoroalkanes, which is the most commonly currently used, which is more efficacious, more effective and greater deposition in the small airways. This propellant, it provides only the medium in which the active component of the drug is delivered. The major disadvantage is the propellant causes majority of the deposition in the oropharynx. As a result, it can cause cough, throat irritation, and that's the disadvantage. You can call it also as cold freon effect. When the cold blast of air comes over, it can cause cough, throat and the patient stops breathing for a moment or breathes via nose. How to use is, you open the cap first, shake it and ask the patient to exhale, and place the meter dose inhaler, close the lips, and as you press the canister, you should take a slow and deep inspiration and take it out and hold the breath for 10 seconds. I exhaled first. You hold the breath for 10 seconds and then leave. You should know that majority of the drug deposition occurs over the oropharynx and less than only 25% goes into the lungs. So you should not forget to gargle after you take the inhaler. And this inhaler, the disadvantage is it can continue to even spray even after the medication has run out. See, one way to find if the canister has become empty is just remove this canister and place it in the water. If it sinks, it shows that some amount of drug is present. If it floats, the canister is empty and it is time to replace. However, it can clog this valve, so it's not accurate. So another method is, majority of the canisters has the number of doses mentioned on this canister. It comprises some, for example, it will be shown as 120 meter dose inhaler. So you can calculate, if you take 2 puffs twice a day, it will last only for 1 month. So the patient is asked to change the MDI after every 1 month. The recent meter dose inhalers comes along with a counter. So in this one, it's very easy, convenient for the patient itself to check how many doses are present. If in this one it shows as 0, means this canister is empty. Unlike the pressurized meter dose inhaler, it doesn't have a canister. It syncs with your breath. It's easy, comfortable, as well as it avoids the need for coordination with breathing. How to use breath actuator meter dose inhaler? You ask the patient to exhale. Take a slow and deep inspiration. Hold the breath for 10 seconds and then exhale. You should know that this device synchronizes with your breath. And for the second puff, you ask the patient to close the cap and then open and take the breath in the same way.